Assalamu alaikum and very good morning. I am Dr. Refat Zahan, Assistant Professor and Head, Community Medicine Department at Akij Medical College, Boyra, Khulna. Today, I will discuss about disease. First of all, we have to know about learning object. Though time is too short, then I will continue my topic in short. First of all, we have to know the definition of disease, the definition of illness, definition of sickness, and theories of causation of disease. All of them are important for both viva and written prof examination. Now, I will start the definition of disease. What is disease? Dis means opposite and is means comfort. That means, as per Oxford English Dictionary, a condition of the body or some part or organ of the body in which its function are disrupted or deranged. I repeat, disease is a condition, it is not a state. From an ecological point of view, disease is defined as a maladjustment of the human organism to the environment. And according to Saucer, disease is physiological or psychological dysfunction. I repeat, disease is physiological or psychological dysfunction. Now, most important definition is illness and sickness. Frequently, these three definition is asking in viva examination, that is, what is disease, what is illness, and what is sickness. Then, illness is a subjective state. I repeat, illness is a subjective state of the person who feels aware of not being well. As for example, if I am feeling fatigue or I am feeling malaise today or I feel febrile today, then it becomes an illness. And as a result, if I am not feeling well and as a result I am not doing my social work today, then it becomes sickness. So, what is sickness? Sickness is a state of social dysfunction, that is, inability to perform his social role. These three definitions are important for both written examination and also viva examination. Then, come to the topics about theories of causation of disease. We have to know what are the types of theories of disease. There are two types, old theories and modern theories. It is also important topics for written examination. Old theories, there are supernatural theory, theory of humors, miasmatic theory, theory of contagion, theory of spontaneous generation. And in modern theory, there are germ theory, epidemiological triad, multifactorial causation, wave causation, and the epidemiological wheel concept. Now, come to the point, old theories. What are the concept of old theories? In supernatural theory, the concept was past sin, evil eyes or ghost or evil spirit. And theory of humors, most of the people thought that impure blood was the main cause for occurrence of disease. And miasmatic theory, it also most of the people thought that bad air was the cause of occurrence of disease. These all are old theories conception. Now, come to the modern theory. In case of modern theory, first of all, we have to know germ theory. We know Louis Pasteur advanced the germ theory of disease in 1873. The conception of germ theory was occurrence of disease, there is a sole factor, that is microorganism. That means microorganisms are the sole cause of disease. It is known as germ theory of disease. But the concept became changes day by day, that is, not only the microorganisms are important or sole cause for occurrence of disease, there are another causes for occurrence of disease, that is, there must be present of susceptible host, acceptable environment or proper environment, and there is a harmful microorganism, that means agent. So the concept becomes that in case of epidemiological triad, a disease process to occur, there must be a unique combination of event that is a harmful agent that comes into contact with a susceptible host and in a proper environment. This triad is known as epidemiological triad, and it also important topic for written examination. What is epidemiological triad? Now come to the another theories, that is multifactorial causation. According to multifactorial causation, the concept becomes that not only the agent, not only the host, and not only the proper environment, there are also some another factor that is important for causation of disease. These factors are social, cultural, genetic, psychological factors which are equally important for occurrence of disease. As for example, if we discuss about tuberculosis, tuberculosis is not merely due to tubercle bacilli. There are some other factors related with tuberculosis, that is overcrowding, malnutrition, and genetic factor contribute to its occurrence. These all are multifactorial causation. Now, web of causation. In this theory, the causative agent is often unknown in case of chronic disease. So, the outcome of interaction of multiple factors, that is all the predisposing factors of any type. For example, myocardial infarction is a web causation of disease. The wave of causation does not imply that the disease cannot be controlled unless all the multiple causes or chairs of causation, at least a number of them are appropriately controlled or removed. If we see the diagram in case of myocardial infarction, then we see that there are two factors related with myocardial infarction, that is unhealthy lifestyle and stress. If we follow the unhealthy food, lack of physical activity causes obesity, and smoking causes changes in the arterial wall. And in another way, stress, it causes hypertension, and in case of stress, most of us habituated with smoking. Then smoking causes changes in the arterial wall, and hypertension also causes changes in the arterial wall. And also another factor is aging. In aging process, there is also changes in the arterial wall, and combinedly this obesity it causes hyperlipidemia, and smoking causes changes in the arterial wall, hypertension causes changes in the arterial wall, and aging also causes changes in the arterial wall. These two changes in the arterial wall and obesity, it causes hyperlipidemia, and changes in the arterial wall, both of them causes coronary occlusion, and as a result coronary occlusion, then it becomes myocardial infarction or myocardial ischemia. Now, epidemiological wheel of concept. This is the last theory of causation of disease. This is another approach to depict man to environment. The host is surrounded by environment. The size of different component of wheel depends upon specific disease entities. The genetic disease, the core will be very large. These all are modern theories of disease which are most important topic for written and also viva examination. Thank you all.